Tiffany Tobabin is a 31-year-old veterinarian from Dallas, Texas. She has seen a number of physicians and specialists for her intestinal problems, which date back to her teenage years. Tiffany's condition, which is known as Irritable Bowel Syndrome, causes unrelenting discomfort as well as symptoms that can trigger overwhelming anxiety.
I had a endoscopy, ultrasound, barium, colonoscopy. I mean, pretty much anything, blood tests, lots of tests, you know, from specialist to specialist to specialist. And it's good because they have to know if you have something else.
And many of the patients become frustrated because they undergo a series of investigations that don't show any abnormalities. But it's important to keep in mind that the purpose of those investigations is to exclude other serious diseases that might be present.
Tiffany also compiled a food diary, but her efforts failed to yield any helpful clues.
I think the thing that was most frustrating is that there wasn't a food that I could pinpoint.
Our brains and intestinal tracts, which each develop in the same part of the human embryo, are linked by vast numbers of nerves. Tiffany's physician, Dr. Lawrence Schiller, a gastroenterology specialist at the Baylor University Medical Center in Dallas, says this brain-body connection is a key aspect of irritable bowel syndrome.
Well, every disease has an emotional component to it, and irritable bowel syndrome is no different.
Anxiety, stress, and tension can lead to flare-ups for many IBS patients. Tiffany recalls her diarrhea was particularly difficult while she was dealing with the rigors of veterinarian school.
You know, you'd be at class all day long and they didn't really like you leaving all the time, and if you're in the middle of a surgery and you're supposed to be holding something and don't let go, and if you have to go, that's a problem.
A lot of patients feel embarrassed talking about these issues. You can imagine that stool incontinence and having accidents and having problems with having bowel movements is not easy to talk about.
Dr. Peter Warwell, a respected IBS expert, tells his patients that IBS is a legitimate medical disorder. And although there is currently no cure, it is a condition that can be successfully managed.
We're going to reduce the level of your pain. We're going to reduce the level of your bloating. We'll try and normalize your bowel function as much as possible and give them various coping mechanisms.
Getting medical attention for a health problem is always a wise idea. Tiffany is pleased with the effectiveness of her latest medication.
I feel great. I don't have abdominal cramps and I'm not having diarrhea.
Free from the painful symptoms of IBS, Tiffany is able to focus more intently on caring for her furry patients as a veterinarian.
Just penetrated, got into, that looks like it's
very rewarding
in his eye.
I get kisses all day long.
Or it could be some sort of a growth.
Seeking a diagnosis and treatment for painful, anxiety-producing symptoms makes far more sense than stoically suffering in silence.